As we saw earlier, the dimensions, whether it is centimeter or square centimeter, debridement coding is always done in square centimeter because the provider is now going to debride a wound, an area of the wound, right? This is all the more important. Sometimes the dimensions might be given. Imagine they would document as a physician debrided a wound of a 10 centimeter into 5 centimeter into a 2 centimeter. In that case, you will have to figure out what is the area that is being debrided. So this would be like length into width into depth. So you will have to multiply length and the width, which is 10 into 5 is 50, centimeter into centimeter, centimeter square. If the area is given, it is well and good. No problem for you to figure out what the area is because they have already given that. So it should be in square centimeter. That is what you have to understand. Because you are going to only debride an area of tissue, area of a non-viable necrotized tissue. Non-viable like fibrin, exudate, those things you are going to debride it. Importantly, you will have to keep in mind that no matter what is the level of the wound, maybe the patient is having a chronic non-healing ulcer, the patient has come for the debridement, though the wound has gone to the level of the bone and the muscle, you will have to see what is the extent of debridement by the provider. It's not that just because a wound is being extending to the bone level, it's not that you will have to put a code for the bone debridement. You will have to figure out where exactly the physician has debrided. If he has stopped with the subcutaneous tissue debridement, you will have to code only the subcutaneous tissue debridement. Okay. So we have the add-on codes here. So for the epidermal or the dermal level, it is 97597, 97598. For the subcutaneous, 11042, 45. Muscle, 11043, 46. For the bone, it is 1144 and 47. So these are the primary and the add-on codes. You need to be careful with the primary and the add-on codes.